Hi, I'm Mrs. McFeeters, and I'm going to be with Mrs. Iverson today to show you how to do a musculoskeletal assessment. So we're going to assume that we've already done our first 5 and we've already addressed any issues they're having with old carts. So going over this musculoskeletal assessment, we're first going to look at the patient's posture. Can you stand for me?
Sure.
So when we're looking at their posture, we're seeing if they stand, if they're even, if they're parallel on either side. We could be looking for kyphosis, we could be looking for scoliosis. Mrs. Iverson is great for us because she actually has a little bit of scoliosis, and so you can actually see that one side dips slightly. I don't see it super well, but
my left side is lower.
So, yeah. So her left side is a little bit lower, so you can actually tell when you're looking at her. So you're going to stand behind and take a look at your patient. You can also stand from the side to check for kyphosis or lordosis. Thank you. Then you're also going to ask them to walk. So you're just going to ask them to walk normally. So if you just take a couple steps across the room for me. Great. And then if you want to walk back and do the heel toe for me. Awesome. So she has good balance. She's able to walk well. She has a smooth gait. So as you're going, you're going to say those things out loud. So the next thing we're going to look at is her TMJ joint. So we're going to first, to check the strength of that, I'm going to palpate here. I'm going to have her squeeze her jaw, and then you should be able to feel that right at the joint, and I definitely can. If you can't, or if it's unequal, that would be unexpected. So next you're going to have them open and close their mouth. As they're doing that, you should be feeling for crepitus, so any crackling. I don't have any of that, so that's normal. You're also going to have her tilt her head down, and then back up. No, I'm going to have you do it against resistance. So push, tilt down. Good. I'm just going to have you here, I guess, up. She should have 5 out of 5 strength. So that would be normal. If she has weakness there, that would be an abnormal. And we're also going to do to the left and right against resistance. So I'm going to put my hand here. She's going to turn, and then going to come to the other side and turn. And she has 5 out of 5 strength on both sides. That's normal. So if you have any weakness, you would report that as 1 out of 5, 2 out of 5, or even a 0 out of 5 if they can't do it. Moving down the body, we're going to talk about upper extremity strength. So I'm going to ask her to hold out 2 fingers on each side and have her squeeze as tight as she can. Great. And then I'm going to have her extend her arms palm up. I'm going to have her try to bend her arms towards her, and I'm going to pull back. Great. And I'm going to have her push against me. Good. So that's biceps and triceps, push-pull motion there. Again, 5 out of 5. And then moving down to lower body strength. So I'm going to put my hands on her thighs and ask her to lift her knees up. Great. I'm going to put my hands on her calves and have her pull back and push forward. So that's having on that muscle at the back of her leg, her quadriceps and hamstrings, testing all those. Then on her feet, I'm going to put my hands on top of her feet and have her dorsiflex. So bring her toes up to the sky. I'm going to put my hands under and have her push down and plantar flex. So she's 5 out of 5 strength everywhere. So that's the strength part of the musculoskeletal assessment. Then we're going to go through range of motion. So to start with that, we're going to go back up to the head because we're doing head to toe. So we're going to do flexion. So I'm going to ask her to do chin to chest again. And all the way back up again. Great. So that's actually hyperextension going all the way back. Rotating, I want her to take her chin to her shoulder to the right and then to the left. And then looking straight at me again, she can take her right ear to her right shoulder, left ear to her left shoulder. So she has full range of motion. And then next, I'm going to have her do her shoulders. So shoulders have lots of fun movements because it's a joint that really moves a lot of different ways. So, do you want to stand up? Do you sure? Okay. So for flexion, we're going to have her lift her arms out straight in front of her. Good. And if you can bring them all the way back, that's hyperextending. I think that's the ones we want to test here. And then from there, I'm going to have you internally rotate. So if you want to bring your hands up and bend at the elbows, and then I'm going to have you bring them out to the side, and then cross back over your belly. Great. And then the last motion.
So that internally and then externally.
Yeah, internally and externally rotation. Thanks. And then we're going to come up and above. It's the last motion that we test. I think it's circumduction. All right, moving on to elbows. So we're going to do flex and extend. So extend would be straight out, and then flex here. So we've already done this against strength. This is just for range of motion. So she has full range of motion. And then for wrists, she's going to flex her wrists, so that means come down, and then extend extend would actually be when they're straight out in front. Hyperextend would be to bring them back. And then you're also going to do ulnar and radial deviation. So ulnar deviation means to ask them to take their hands and move them to the pinky side, and then take their hands and move them to the radial side. And she's able to do that, full range of motion. And then she's going to do, we're going to ask her to do her fingers. So I'm going to have you make a fist. So that's going to be flexion, and then extension would be to open them all the way up. And then she's going to adduct and abduct. So add means to move together, so you can move them together. And then abduct, move them apart. And then that would be our full range of motion. So she had 5 out of, did I skip something? Back to knees, we're doing one more. So she's doing extension. So sitting right now, she's in flexion. So she has her knees bent. I'm gonna ask her to extend her legs out and have them bend it back. So flexion and extension. Okay, so for knees, if you look at Mrs. Iverson now, she's sitting in flexion. So she's already bent her knees back, so she's in flexion. So then I'm gonna ask her to extend and then just flex back. Great. We're gonna go to ankles. I'm gonna ask her to internally rotate and externally rotate. So internally rotate towards the inside of the leg, and then externally to the outside of the leg. So, and then one more with those, we're gonna ask her to dorsiflex and plantar flex, which we already did against strength. So again, she's gonna push down to the ground, so plantar is down to the ground, and dorsiflex up. Again, full range of motion there. Any pain with any of those movements?
Nope.
Great, so she has 5 out of 5 range of strength and full range of motion in all joints.